this special edition of the Research Sofa. I'm here today with Pete and Piran from the Green and Blue Spaces theme in the Closing the Gap network. So I'll just pass over to Pete and Piran to introduce themselves.
Thanks, Emily. Yeah, my name is Piran White. I'm a professor in the Environment and Geography department at the University of York, and I'm also co-lead for a theme on environment and health in the York Environmental Sustainability Institute. So my research focuses on ecosystems and their links with human health and well-being. I'm interested in green and blue spaces and how we can use green and blue spaces to enhance people's mental and physical health and well-being. And I'm also interested more broadly in the impacts of environmental change, particularly climate and land use change on health and well-being, through, for example, understanding how that impacts people's vulnerability and how we can develop good adaptation practices in order to maintain and enhance people's health and well-being in the face of some of these changes.
Thanks, Emily. Thanks, Piran. Yes, I'm Pete Coventry. I'm a senior lecturer in the Department of Health Sciences here at the University of York and co-lead with Piran the Environment and Health Research theme at YESI. And my research focuses on the evaluation of nature-based interventions and more broadly nature-based solutions for people with mental health problems. But I'm also interested in how we can use these approaches to connect people with nature to integrate mental and physical healthcare for people with multimorbidity.
Thanks both, and really pleased to have you with us today on the Research Sofa. And I just wondered whether you could tell us a bit about a couple of the projects that you've been working on in terms of the green and blue space theme.
Yes, I can start, thanks. So one of the things we've been looking at is trying to understand associations of the distribution of green and blue spaces with the prevalence of serious mental illness. So we know from previous research that being closer to nature or green space can be linked to the development of serious mental illness, and also proximity to some blue spaces like rivers, especially in low-lying areas, can also be linked to mental health conditions. And other people have shown that things like traffic noise and air pollution can also be linked to serious mental illness, as well as more common mental disorders. So what we've been trying to do as part of our Closing the Gap research is to understand better the links at different scales between environmental exposures and serious mental illness. So we've done a study looking at the associations between prevalence of severe mental illness and availability of green and blue spaces across England and also in some of the major conurbations. So we've looked at Greater London, we looked at Birmingham, Liverpool, Manchester, Leeds, and Newcastle. And at a national scale, we found some associations with higher levels of severe mental illness with, for example, greater distance from rivers and lakes, higher levels of particulate matter pollution, and also proximity to roads with high noise levels. But we've also found differences between urban areas. And one of the consistent things with these differences is the importance of blue space, whether it's lakes or rivers. And it seems to have a consistent presence in these relationships, even though the sign of the relationship, blue space, is sometimes somewhat different. So, for example, we found that in Birmingham, prevalence of serious mental illness is positively associated with proximity to urban green spaces with a lake. In contrast, in Birmingham, Liverpool and Manchester, we found that prevalence of severe mental illness is actually higher in areas further away from flood risk, whereas in Leeds, it's higher in areas closer to flood risk. So this is really interesting in terms of these differences that we find. And it's likely, although we haven't actually been able to test this, it's probably due to some of the context around these spaces. So, for example, if in certain cities, some of these areas have been regenerated and are now occupied by higher quality housing with higher quality outdoor environments and so on, whereas in other areas, some of these may be left behind areas with poorer quality housing and so on. So this has lots of implications, for example, of how we could potentially use some of these green and blue spaces to improve mental health. And one of the things we're also been interested in is the extent to which we can use these so-called nature-based solutions to improve people's health. And this relates to some of the other work that we've been doing that Pete can talk about.
Yeah, so thanks, Piran. As you mentioned, we are also interested in how we use nature-based interventions in an applied sense. So how can people benefit from engaging with nature? So to start with, we've conducted, as part of Closing the Gap, a systematic review. It's the most comprehensive systematic review with meta-analysis of the effectiveness of outdoor nature-based interventions for both mental and physical health. So we took a very broad view here, and we wanted to review the effectiveness of a whole range of different types of activities that people might engage with in outdoor green and blue spaces. And when I say blue spaces, that essentially means spaces with access to water. So we're looking at things like gardening, all forms of what you might call horticultural therapy, green and blue exercise, but also things that are explicitly deemed to be therapeutic. So forest bathing and other nature-based stress reduction activities. And as I said, the outcomes of interest were symptoms of mental health, such as depression and anxiety, but also we were quite keen to see whether there's any evidence for the impact on physical health. So we looked at things like blood pressure and physical activity. And it's just important to mention that this review included adults of all populations, so healthy volunteers, people with long-term health problems, and people with both common mental health problems and serious mental illness. And in total, we found evidence including 50 studies, and those studies were across a variety of different types of designs. So we looked at experimental evidence, but also single group or before and after studies, and we analysed the results separately for each type of study. And what we found was really interesting. We found that across the board, regardless of what kind of population we were looking at, nature-based interventions improved mental health symptoms, especially depression and anxiety. And that also included people with serious mental illness and those with long-term physical health problems. And when we looked at which interventions were most effective, we found that interventions that were generally delivered in groups for around 8 to 12 weeks were generally the most effective. And interventions didn't need to be delivered over a very, very long period of time for them to have some positive effect. So 20 to 90 minutes per session seemed to be an effective dose of nature, so to speak. And in terms of which activities were most effective, we found that gardening or any kind of horticultural activity, such as growing food or tending to sort of community allotments, those were very effective in terms of reducing depressive symptoms, including, as I say, in people with serious mental illness. We also looked at the impacts on what's called positive and negative effects. So these are emotional states that are important for mental health. But we found that the impacts of these interventions were slightly less good for people with serious mental illness. So there was something there about whether all these interventions were equally effective for all populations, depending on the outcome of interest. But in general, I think we found there is good evidence, or at least emerging evidence, that these approaches are effective. What was, I think, a little bit surprising, given the interest in physical health benefits for people with mental health problems, we didn't find very much in terms of the impact of nature-based activities on physical health. So there's still quite an evidence gap there in terms of its impact on things like physical activity and risk factors for things like cardiovascular health. So overall, I think we've concluded that there is a good evidence base for understanding how these interventions might be used for people with mental health problems, but there are gaps, and those include whether these interventions might need to be slightly modified or tailored to help people with SMI to engage with them, and also whether they can be modified to specifically impact on physical health too.
So this is all really interesting, especially during COVID, and there seems to be much, increased interest in green and blue space and the importance of green and blue space and the awareness raised about this. So I think all this work really ties in nicely with this enhanced interest going on. And I just wondered what you think the next steps are for your work.
So if we think about some of the sort of association type work we've been doing, one of its inherent limitations is it's essentially area-based, and that enables us to understand broad patterns, but it doesn't tell us anything about causes and consequences. And it also masks differences at individual level in relation, for example, to specific environmental exposures, accessibility to green and blue spaces, etc. So some of our plans for future work involve trying to better understand the possible causes of the variations that we observe, because then if we're thinking about what area-based interventions we can put in place, these will help us to understand what might be most effective. And in relation to that, one of the things is it's really important to understand the quality of green and blue spaces. So what determines whether a space is actually of high quality in terms of its potential impact on health outcomes. And although we have various ways in which we can identify quality as we might perceive it, whether it's ecological quality or aesthetic quality or whatever, what we really don't know is how those subjective measures of quality actually impact on mental health and so on. And one of the other interesting things that's come out of this work in particular is this really strong association with blue spaces and the impact of blue spaces. And it would be really interesting to know what it is a bit more about blue spaces that is really important in linking to health, over and above, for example, exposure to nature in general, because it certainly does seem to be something that comes through in that work. And I think we also need to do more studies at individual levels. So, for example, it would be really important, especially if we're thinking about a population with serious mental illness, to understand how people with serious mental illness and different forms of serious mental illness respond differently to some of these environmental exposures, exposure to nature, and what underpins this. So, for example, thinking about whether the different conditions themselves have an impact on exposure responses, whether people's socioeconomic background, whether their lifestyle is important. All these factors are really important if we try to then move from this broader understanding to develop ways in which we can use nature to actually enhance people's health or delay the onset of serious mental health conditions and so on. And underpinning that, again, and what we really don't know anything about is some of the physiological mechanisms underpinning some of these associations as well. So there's a huge amount of work we can potentially do, linking up, for example, with physiologists, molecular biologists, psychologists, to really try and get this holistic understanding of how nature impacts on individuals' health, and therefore how we can use it to benefit people's health.
Yeah, just to pick up, Emily, on what Piran's just said there about future work, especially at the individual level, there's certainly more scope to understand which interventions are most effective. So although our review did pick out certain activities that we think were beneficial, we're not entirely clear of the exact components of these interventions and how long they should run for. And certainly we're not sure very much about how these interventions can be deployed in blue spaces. So a lot of literature is very much focused on green space alone, and we know much less about how we can harness the benefits of access to blue spaces. And just picking up on that point about making them more applicable and more accessible for people with SMI, that's certainly something I think we need to think carefully about, given that we know certain populations have difficulties accessing these interventions. And also just in terms of what we can do as health scientists and as environmental scientists, and building a very robust evidence base. Most of the evidence that we reviewed was generally non-experimental. So there's a real need to push for experimental or quasi-experimental sort of studies that can help us gain a much more definitive understanding about which interventions are effective.
It's all really interesting and, really important work. And, there's been a lot of interest in our green and blue space theme over the last few years in Closing the Gap. So it's really nice to have you on the sofa today, telling us a bit more about the work you've been doing, what you're thinking needs to be done next. So thank you so much for joining us. Really grateful to that. So thanks everyone, and bye.
Thanks for having us.